Hey guys, our chosen sport for this injury prevention module is football, or is commonly known as soccer in Australia. And our two chosen injuries within this sport are hamstring strain injuries and anterior cruciate ligament injuries. So the first injury we're going to focus on is hamstring strain injuries. So I'm going to talk about how we would implement strategies that will reduce the risk and prevalence of hamstring strain injuries within football. So here is a quick summary of why we chose hamstring strain injuries as a need for a prevention program in football. As outlined by multiple studies, and also by Ekstrand and colleagues, hamstring injuries are the most common injury in football, accounting for around 37% of lower limb muscle injuries. With the large prevalence of hamstring injuries within football, this places a significant financial and time loss burden on athletes and clubs, having players missing from games and players in rehabilitation. The implementation of hamstring injury prevention strategies aims to reduce these burdens, to place more athletes on the pitch with less time rehabilitating to help teams achieve a greater success throughout the season. So when determining prevention strategies, it's important to firstly identify the risk factors for the particular injury. Therefore, if the focus is on reducing the risk factors, hopefully the prevalence of injuries will reduce too. These two papers by Opar and colleagues and Timmins and colleagues both identify the risk factors for hamstring strain injuries through the use of a novel device that measures eccentric strength through a Nordic exercise. Although the paper by Opar and colleagues uses AFL athletes instead of footballers, both sports possess similar physical qualities, such as endurance and lower body strength, with both having high hamstring strain injury rates that place a burden on both of the sports. This paper found that athletes with weak eccentric strength were more likely to endure a hamstring injury compared to those that had better eccentric strength. Timmins and colleagues also found this in elite football players, but in conjunction with this, they measured the fascicle length of the biceps femoris long head during the Nordic exercise. The findings revealed that the athletes who had short fascicle length were more likely to endure a hamstring injury than those with longer fascicle length. Therefore, it can be determined from these two papers that these two structural and functional components of the hamstring muscle are associated with the increased future risk of hamstring strain injuries. So it's important that these two components need to be taken into consideration when creating a prevention intervention to target increasing knee flexor eccentric strength and fascicle length of the hamstrings. Many research papers out there on preventative methods for hamstring injuries use some sort of intervention involving eccentric Nordic exercises. And both of these papers by Peterson and, forgive my pronunciation, but Milnes use a 10-week hamstring strengthening intervention on professional footballers. Peterson and colleagues looked at the incidence rate of hamstring injuries after athletes were exposed to a Nordic hamstring intervention. They found that there were significant reductions of first-time hamstring strains and recurrence hamstring strains compared to the control group. The second paper by Milnes and colleagues looked at the effect of concentric versus eccentric hamstring training on strength. They found that the eccentric training group who used the Nordic exercise had a greater effect on strength compared to the concentric group that used hamstring curls. Therefore, the Nordic hamstring intervention that both studies used led to a decrease in rate of hamstring injuries and increase in strength. In conjunction with the study down the bottom by Timmins and colleagues, they found that athletes exposed to a similar Nordic exercise intervention found an increase in fascicle length. Therefore, based off these studies, it would be important to use the Nordic hamstring exercises in the hamstring strain injury prevention intervention, as we have found they improve the two risk factors as mentioned on the previous slide. So how will the Nordic exercise be implemented into a typical football season? The exercise will be implemented into pre-season through a gradual progression of sets and reps to slowly increase the strength and fascicle length of the hamstrings. As reported in the Timmins and colleagues paper on the previous slide, fascicle length shows a very transient decline after a Nordic intervention. Therefore, it's important to maintain the structure of the hamstrings throughout the whole season by implementing the Nordic exercise in both pre-season and in-season. Testing of eccentric strength will also be important during the pre-season and in-season to ensure that the level of strength is being met by measuring change and also that the level of strength is being maintained throughout the season. The pre-season testing will occur at the beginning of pre-season to get a baseline measure, halfway through pre-season to make sure that they are progressing, and at the end of pre-season to again measure the progression. In-season testing will occur once midway through the season to monitor any changes. As taken from the papers by Peterson and Milneses, the pre-season Nordic intervention will follow exactly as they have done, implementing it into football training with a progressive increase in sets and reps and also the number of sessions per week. Whereas in the in-season, it will focus on maintaining function and structure of the hamstrings. The Nordic intervention will be performed twice a week at 3 sets of 8 to 10 reps. As you can see here on the right is an example of what a training day could look like for any football team, with a field session, a gym session, and some recovery afterwards. The Nordic exercises will be included into the gym training sessions, as it's the most convenient to perform alongside the rest of the exercises, where the Nordics will be performed more towards the end of the session. So some of the considerations that should be taken into account when implementing the Nordic exercise intervention is that the exercises are not time-consuming in the gym and is inexpensive with the little equipment needed to perform the exercise. In terms of testing, there is an eccentric strength testing equipment called the Nordboard, which is great for testing, however is expensive, and the clubs that may not already have this device already may not have the budget for it. So at least they can use the Nordic exercise just without the testing and monitoring component. The implementation of Nordic exercises into any team is great as it can be applied to all athletes, even rehabilitating athletes that are returning to play with the use of resistance bands to reduce the load placed on the hamstrings. So thank you very much for listening. So now I will pass you on to Lillian, who is going to talk about ACL prevention.
Thanks for that, Tom. Now going to look at anterior cruciate ligament injuries for elite soccer teams and the importance of prevention and why it is necessary and how it can be implemented into a training program. Before we start discussing how an ACL injury program would be implemented into training, we need to talk about why it is necessary. So Gottlob and Baker in 2000 said that ACL or anterior cruciate ligament injuries are one of the largest economic burdens from injury. It costs on average $1 million in the USA each year and is one of the most expensive injuries for a professional sports team or organisation to treat. Furthermore, they stated that with potentially long rehabilitation time, clubs aren't able to afford to lose crucial players who may be worth a lot of money on the payroll. These players need to be available for match selection and training as they may change the impact of the way the team plays. The athletes obviously need lots of time off from training and match play if an ACL injury does occur for rehabilitation, and then it will take even longer for them to get back to their match fitness before they can participate in match play. So obviously there's quite an extensive amount of time lost there. Furthermore, if interacting with a female team, these are at much higher risk of non-contact ACL injuries. Ireland stated this in 2002. He stated that females have a 2 to 9 times greater risk of incurring a non-contact ACL compared to male counterparts. This can be due to gender differences, strength deficits, and changes in landing mechanics. As well as this, ACL has a high rate of re-injury, with a common reoccurrence of injury within 2 years of a previous ACL. This was stated by Wright and his colleagues in 2007. In the study that they followed over a season, 1 to 4 in every 17 patients undergoing an ACL reconstruction, it was their second time they have injured their ACL, either on the same leg or the other leg. So once the athletes do have that first ACL injury, there is quite a high chance that they will then receive a second injury within 2 years. So obviously we want to try and avoid that first one so that we don't have the increased financial burden of a second injury for these athletes. So how would this intervention work in terms of what type of exercises? So obviously, as you can see there, there's proprioceptive work, neuromuscular exercises, and plyometrics. Now, if you are familiar with the FIFA 11 program, you will know that proprioceptive work, neuromuscular work, and plyometrics are all involved in that FIFA 11 program. So proprioceptive work is exercises which include balance and proprioceptive awareness. The exercises given to the athletes would obviously depend on the ability level and would involve lots of single leg work. For example, a very basic proprioceptive exercise would be standing on one leg and balancing, eyes open, and then eyes closed for a harder challenge. Obviously, as the season continues on, these players would then receive harder exercises for them to do. Neuromuscular work is going to increase the strength of the muscles in the knee and encourage strong neural pathways with appropriate landing mechanics. So this is really important in terms of knowing how to land, as majority of non-contact ACL injuries is from a cutting or landing task. So we obviously want to emphasize those good landing mechanics and make those muscles nice and strong. Similar to neuromuscular exercises is plyometrics in regards to the way it encourages appropriate landing mechanisms and those strong neural pathways. It works on the explosive work that's required before the landing as well as the landing in there. So as I said before, these different forms of exercises are all found within this FIFA 11 program, and they all have similar goals regarding knee stability and strength of the knee, and again, emphasizing those good neuromuscular pathways. So how would this program be implemented into the training program? So it's important that time's allocated to this, as we've seen earlier. The ACL injury can also accompany the hamstring strain injury prevention, which Tom spoke about earlier. So as you can see on the left-hand side, in gym training, you have lower body strength, Nordic hamstring strain injury prevention, as well as ACL injury prevention. So that would be inclusive of the neuromuscular work, the plyometric work, and the proprioceptive work as part of that gym training program. It would be emphasised heavily during the pre-season to establish strong foundations for the athletes so they're quite comfortable with the program. So that during the season, it's really only maintenance work that needs to be done. Obviously, this is also advantageous so that athletes are prepared for hamstring strain injury and ACL injury from day one, rather than kind of emphasising it later in the season when it could be too late for many players. Now we've discussed why it's important to have an ACL intervention program, what exercises are involved in this, and also how it would be implemented into a training program. And now we're going to discuss the benefits of having an ACL intervention. As you can see here, it states it's a reduced financial burden of ACLR and rehabilitation. So this means that having an ACL injury, the subsequent possible ACL reconstruction and the amount of time spent in rehabilitation would have a large impact on the athlete and the team in terms of time loss and financial loss. So by having this ACL intervention, it is reducing the amount of money that a team would need to spend on ACL reconstructions and rehabilitation. As well as this, having less athletes with an ACL injury means that more players are available for coaching staff. This means that they're able to employ the best possible tactics depending on the competition that they may be playing the next week or the coming week. This also means there's a higher chance for athletes to be scoring goals and points and winning matches in that way. Obviously, if you've got your key striker out due to an ACL injury, that is going to have a big impact on the way the team plays the game. As well as this, the cost of introducing this intervention is quite minimal, because there's no extra equipment required, there's no extra staff required, as you can see stated at the bottom on the left-hand side. So obviously that means that the impact that this is going to have on the club financially is only going to be positive. However, it is important to say that there is a little bit of extra training time involved for the players, obviously because there's a few added extra exercises added into the end of their program. However, if you think about the large return that the players are going to get from this in terms of being available for work, obviously training and match play, and the coaches then being happy with their performance, this is really important for the athletes as well as the club. So it benefits everyone overall. There are some things to consider with the ACL program. The biggest issue would be with athletes being compliant to the program. Obviously, this can be counteracted by reinforcing the positive culture of the club. So that means, having the values up on the walls, reminding players that they need to be there and at training and it's important to participate fully. Furthermore, putting into the players' contracts regarding their expectations of what they will do at training is really important as well. This is really important for the players, especially if they want to be available for this starting 11. Obviously, the way that they participate in training will obviously impact the coach's decisions regarding who is going to start on the pitch. Emphasising to the senior players that they need to lead by example will really help influence the younger players who may be complacent within the squad or a bit nervous or trying to hide in the numbers. So obviously encouraging those senior players to lead by example, do the exercises and do them properly and do them with enthusiasm will make a really big difference to those younger players who will be looking up to their senior players to lead the way. As well as these other interventions I've already listed, including a short but engaging education session at the start of the season about why ACL prevention is so important may be of benefit to the players. So using a setup similar to this, setting up a slideshow and talking to the players about what it's going to mean for them and what it's going to mean for the club and everyone else in the team as well might be really important and give them a bit more understanding of why they're doing what they're doing. And that can help then, rather than just going through the motions of the exercise, there's a bit more purpose and a bit more emphasis in what they're doing, so that because they do understand why it's so important, they're not just going through the motion. So that's a couple of ways to combat that compliance issue, which really will be the biggest issue with implementing the program. So here are just some references at the end. Hope you've enjoyed this presentation and found it really informative and interesting, and thank you very much for listening.